The 2022 South African census has set the record of the highest reported undercount of 31%. This is about 10% percentage points higher than the undercount for the previous census. It brings into question the accuracy and usefulness of the information for government planning and resource allocation. Professor of Demography at the University of Cape Town, Tom Moultrie, joins us now for more. Professor Moultrie, a very good evening to you. Thank you for your time. Now, this issue around the reported undercount of 31% is some 10 percentage points higher than the previous highest notified undercount. How should such an outcome be interpreted?
Thank you, Paul. The big concern is that a census tries, obviously, to count every person in the country, but it is not uncommon for censuses to undercount their population, and there are valid and rigorous techniques for adjusting the undercount. The real issue here is that the undercount of 31% is so great, and as you said in your introduction, is 10% higher than the previous world record for an undercount, and equally is nearly double, or more than double, the undercount in 2011. And so the issue here relates to the fact that where there is such an undercount and there's an adjustment for the undercount, the extent of the adjustment is such that the data will end up looking more and more like the adjustment for the undercount. The population counted was roughly 40 million. The reported population was 62 million. And how we got from the 40 million counted to the 62 million in the census is a function of that adjustment for the undercount.
Yeah, and I mean, look, it's problematic and very concerning as we perhaps go even deeper here, trying to get some understanding on what sort of operational and logistical difficulties could have resulted in such an undercount.
So the first concern, obviously, and the first explanation must lie with the COVID pandemic. Trying to run a census in a major global health crisis was always going to be a really tough ask. And with that, the intention, I think, had been to run the census mostly as an online data collection. People could register online and enumerate themselves online. And most of that didn't happen, partially because of the COVID pandemic. And so Stats SA found themselves at very short notice having to mount an enormous fieldwork operation to go door to door to count the population. So that was the first problem. Tied to that was the fact that the census period was supposed to be wrapped up by the end of February, but we know that in the Western Cape, they were still trying to enumerate the population as late as May of 2022, and that meant that the adjustment exercise, which is used to estimate the undercount and then adjust the data, started much later than international records would actually, or international protocols would recommend usually. So that's the second reason. And I think the third reason is curious in the sense that it's certainly clear from Stats SA's own annual report that it would appear that the National Treasury did not give Stats SA permission to roll over some of the census budget from the one financial year, the ending March 2022, into the following financial year, thereby forcing Stats SA's hand in order to get any census conducted before 2031 to try and complete that census as quickly as possible within that current financial year. And I think that might well have contributed to the problems too.
As we try and also find some of the loopholes and identify some of the weaknesses, what sort of aspect do these findings now call into question when it comes to reliability and, of course, the outcome, and what this means for planning for government and resource allocation, in particular when it comes to the equitable share formula?
Yes, so our conclusion, based on our understanding of patterns, particularly of fertility and mortality in the country over the last 10 years, would suggest that the undercount adjustment actually overcompensated for the undercount by roughly an order of about 1 million people. So the national population, we think, is probably a million people fewer than the census revealed. When it comes to the equitable share formula, we have identified a number of problems at provincial and increasingly at smaller levels, at district and municipal levels, of how the census data are simply incompatible with data from the past censuses, with data from the local government election voters' rolls, which took place, those elections took place in 2011 and 2021. And so we think that while at a provincial level, the distribution of an equitable share formula or resources from the National Treasury to the provinces will be affected by the problems which we've identified with the census, the much greater problems will appear with resource allocation at a district or a municipal level, and that's where service delivery really, and the rubber of service delivery hits the road, whether you're talking about delivery of healthcare services, schooling, education. And so we have great concerns as to whether, certainly at a provincial, district and municipal level, whether the census is a fair representation of the distribution of the population.
We're learning that another census is unlikely to be conducted before the year 2031, which of course, begs the question on what the implications are and what needs to be done from this point forward.
Yes, South Africa tries to run its censuses every 10 years. Obviously, the first, the census in 2022 was delayed by about 7 months because of the COVID pandemic, which should have ordinarily been completed in October 2021. And so our next scheduled census is in 2031, and that is going to be the next time that we get a full and proper accounting of the South African population. In the meantime, given our concerns that the national, provincial, district and municipal population numbers may not be fit for purpose for allocating resources, we need to start a process to produce at least what we think is a coherent and consistent set of estimates of the population, certainly down to a district level, which might be able to be better used by policymakers, by planners, to really assist in the delivery of services and the betterment of the lives of all South Africans.
With this outcome, I mean, should we be skeptical of other outcomes in previous years when the census is done?
So the first thing to note is that the undercount in the census was markedly higher than in previous censuses. In 2011, it was of the order of 14%. In 2001, it was of the order of about 17%. So, firstly, we have been able to work with the extent of the undercount of previous censuses, and at least those results, those previous censuses, have shown a consistency with each other. The people who were aged 10 in 2001 would have been aged 20 in 2011, and those numbers more or less hung together after allowing for mortality and migration, for example. This is not the case with the current census, and so we have a lot more concerns about the quality of this census relative to previous ones.